Advanced care planning conversations are complex, and the barriers to completing these conversations are primarily based around inadequate training in having these conversations with patients, lack of time to engage in these discussions, and residents' lack of education about ACP options. According to a Kaiser Family Foundation survey, 97% of people say it's important to put their wishes into writing. However, only 37% reported actually having done so. Before any other solutions are used, it's important to maximize communication. First, making sure patients have access to any visual or hearing aids they need. If they do not have any available, personal amplifiers are a cheap and portable solution. Using the ask-tell-ask paradigm in conjunction can help ensure patients have a good understanding of the discussion. One of the largest barriers to having ACP conversations is lack of provider time and discomfort with the conversation itself. One study showed that 91% of patients perceive their healthcare provider to be uncomfortable when talking about ACP. To solve this problem, we will implement a 1-month geriatric clerkship mandatory for medical students and available to all other health professionals, as well as those who wish to gain experience with geriatric populations. As part of the clerkship, students will be tasked with having ACP conversations with nursing home residents, freeing physician time to care for critically ill patients and giving students experience in having these conversations. Additionally, as our population ages, the geriatric clerkship as a whole will prepare future providers in caring for this population of patients, with a focus on the special ethical and clinical considerations for these patients. In tandem with the clerkship, we will develop an app called Sunset to aid students in having these conversations. The Sunset application allows us to simplify the process of the resident and clinician conversation by providing a medium to allow the residents to understand the questions being asked to them and to have a trained healthcare professional with them to help facilitate this process. The Sunset application questionnaire will be easy to understand, easy to complete, and designed to ensure that each resident has autonomy over their advanced care plan in a format that they can easily comprehend. A typical conversation with a patient would begin with identifying if the patient has capacity. Once that's assured, the student will help the resident fill out the questionnaire to begin considering what advanced care measures are compatible with their goals. If any questions identify advanced needs, the resident will be referred to another provider. Next, the student initiates and facilitates conversations regarding their specific ACP concerns. This would also be a good time to have family members join in the conversation if the resident desires. Then the student helps the resident fill out the ACP preferences on the Sunset app. Once completed, the patient's responses will be able to be uploaded to health databases. The responses will also be able to be formatted into a PDF to be printed out or sent to an email. The app will help facilitate this conversation by using simple, easily understood language and video examples. Videos have been shown in research to assist informed decision-making by decreasing uncertainty regarding subjects' preferences, especially for those with limited literacy. Additionally, it will streamline the process for advanced directives. One study published found that although 89% of patients reported a decision on resuscitation, the directive was not followed by the medical team in 71% of the resuscitations. Patients in nursing homes will have a code that can be scanned on their medical bracelets that will connect to their ACP directives quickly and effectively. The COVID-19 pandemic makes ACP conversations even more complex. Having an available student workforce to help prioritize having these conversations with vulnerable populations facilitates more residents having advanced care directives. Students will also be able to help residents contact family members who wish to be a part of the conversation, as well as using their own personal devices. Additionally, the Sunset app's ease of use will allow other nursing home staff to help residents formulate care directives if COVID prevents students from visiting during their geriatric elective. While we suspect that different educational and cultural barriers could affect some residents' abilities to access and utilize the Sunset app, research has shown that people of different ethnicities have varying rates of utilization of advanced directives. Past research has shown that non-white patients are less likely to have living wills and more likely to die with full support. We intend to create an app in multiple languages and provide over-the-phone interpretation services as needed. Although these disparities need to be addressed at a larger scale, it is our hope that our diverse student population will help facilitate these conversations. For outcomes, students will manage the Sunset database, performing retrospective chart reviews to analyze if the care received is consistent with the resident's ACP goals, and assess if resident family and physician satisfaction in this new approach to ACP via surveys. By training healthcare professionals to understand the nuances of advanced care plans and the decisions that need to be made, we will ensure that residents feel that they have the resources they need to make informed decisions about their medical care, as well as their priorities towards the end of life. This interplay provides reassurance to residents and a valuable learning experience to healthcare students about their responsibilities in a person's advanced care planning.